Question number 1. The nurse is about to administer enema to a patient. Which position is suggestive for administering an enema? A, B, C, or D? Option B is the correct answer. Now moving to the next question. Question number 2. View of the chest shown in images: anterior view, posterior, lateral, or none of the above? The correct answer is C, lateral view. Question number 3. Device shown in image is leg section motor, sequential compression device, warmer, or anti-embolism stocking? The correct answer is option B, sequential compression device. Now moving to the next question. The nurse is positioning the client in for a planned procedure. Refer to the image to identify the selected procedure. Option A, hypophysectomy. Option B, hemorrhoidectomy. Option C, perineal inspection. Or option D, paracentesis? Yes, the correct answer is option C, perineal inspection. Question number 5. Identify the instrument. Option A, BP handle. B, needle holder. C, Mayo's towel clip, or uterine current? The correct answer is option A, BP handle. Now moving to the next question. Question number 6. Choose the correct statement about the instrument shown in the figure. Option A, it is used to inspect posterior part of nose. Option B, it is used for holding delicate structure. Option C, it is used for taking cervical biopsy. Option D, it is used for holding sponges and swabs while painting operating site. Yes, the correct answer is option D. Now moving to the next question. Question number 7. The ICU nurse is caring for a patient diagnosed with multiple fracture and pneumothorax. The nurse refers to the clinical notes of the patient to reveal that the patient has undergone which fracture. Refer to the image to identify the fracture. Option A, transverse. B, spiral. C, green stick. D, comminuted fracture? Yes, the correct answer is option D, comminuted fracture. Now moving to the next question. Question number 8. Device shown in the image is ECT machine, ECG, defibrillator, cardiac monitor? Yes, the correct answer is option B, ECG machine. Now moving to the next question. Question number 9. Supplementary oxygen device used by the patient is, refer to the image. A, venturi mask. B, nasal prongs. C, simple face mask. D, partial rebreather mask? Yes, the correct answer is option B, nasal prongs. Now moving to the next question. Question 10. The nurse is giving interventional therapy to the newborn. Refer to the image and identify the therapy used. Option A, KMC. Option B, radiant warmer. Option C, phototherapy. Or option D, exchange transfusion? Yes, the correct answer is option C, phototherapy. Question 11. The nurse is vaccinating a child in immunizing clinic. Refer to the image and choose the correct option related to vaccine. A, killed vaccine. B, live vaccine. C, toxoid vaccine. D, recombinant vaccine? Yes, the correct answer is option B, that is live vaccine. Now moving to the next question. Question number 12. Identify the contraceptive device shown in the figure. A, male condom. B, Dutch cap. C, femidom. D, vaginal contraceptive sponge? Yes, the correct answer is option B, Dutch cap. Now moving to the next question. Question number 13. The nurse is vaccinating a child in immunizing clinic. The nurse knows that which vial can be used for administering vaccine. Refer to the image. A, B, C, or D? Yes, the correct answer is option B. Now moving to the next question. Question number 14. Choose the correct statement regarding the plane shown in the image. Option A, divide the body into left and right section. Option B, divide the body into upper and lower segment. Option C, divide the body into front and back section. Option D, divide the body into upper, lower, front and back segment? Yes, the correct answer is option C. Now moving to the next question. A postnatal mother comes to OPD for follow-up. While performing the assessment, the nurse inspects vulva pad of the mother. On inspection, the nurse found scanty discharge, creamy whitish in color. Refer to the image to identify the type of lochia. A, lochia rubra. B, lochia serosa. C, lochia alba. D, amniotic fluid? Yes, the correct answer is option C, that is lochia alba. Now moving to the next question. Question number 16. Device shown in the image is vaccine vial storage box. B, emergency crash cart. C, dressing trolley. And D, X-ray machine? Yes, the correct answer is option B, emergency crash cart. Now moving to the next question, question number 17. The symbol present in the waste container implies that waste is biohazard waste, cytotoxic waste, anatomical waste, or recycled waste. Yes, the correct answer is A, biohazard waste. Question 18. Choose the correct statement about the diagnostic test shown in the image. Option A. It is a non-invasive test done to measure power of intraocular lens. Option B. This is a color vision test, that is Ishihara test. Option C. This test evaluates the field of vision and it is helpful in detecting blind areas in visual field. Or option D. This test is used to evaluate retina and macular disease as well as anterior segment conditions. Yes, the correct option is option B. This is a color vision test, that is Ishihara test. Now moving to the next question, question number 19. Tubing shown in the image is termed as A, venticular circuit, B, brain circuit, C, urethral tube, D, Miller-Abbott tube. Yes, the correct option is brain circuit. Now moving to the next question. Gastrointestinal tube shown in the image is A, Sangsticken Blackmore tube, B, Miller-Abbott tube, C, Levin tube, D, Salem Stump tube. Yes, the correct option is C, Levin tube. Question number 21. The nurse is analyzing ECG strip of a patient. The nurse knows that this arrhythmia reflected in the ECG strip is A, ventricular dysarrhythmia, B, atrial fibrillation, C, atrial flutter, D, ventricular fibrillation. Yes, the correct option is option B, that is atrial fibrillation. Now moving to the next question, question number 22. The nurse is preparing a patient for lower extremity amputation. The nurse recalls that lower limb amputation has certain levels. Refer to the image and identify the level of lower extremity amputation. Yes, the correct option is option C. That is, first indicates above knee amputation, second below knee amputation, third sime amputation, fourth toe amputation. Now moving to the next question. Question number 23. A patient came to OPD with certain clinical features. Refer to the image for clinical presentation of patient. Suggestive diagnosis of the patient is A, hypothyroidism, B, Cushing syndrome, option C, Addison disease, D, Cohn syndrome. Yes, the correct option is option B, that is Cushing syndrome. Now moving to the next question, question number 24. A patient diagnosed with bladder cancer is planned for urinary diversion procedure. Refer to the image and identify the urinary diversion procedure. Option A, Cox pouch, B, ileal conduit, C, Indiana pouch, या D, colon conduit. Yes, option B is the correct answer, that is ileal conduit. Now moving to the next question, question number 25. The nurse is caring for a patient with a drain. The nurse monitors the drainage amount, color, characteristics of the drain and record it. Refer to the image and identify the drain inserted to the patient. Option A, Hemorrhagic drain. Option B, Jackson-Pratt drain. Option C, pigtail drain. Option D, intercostal drain. Yes, the correct option is option B, that is Jackson-Pratt drain. Now moving to the next question, question number 26. A patient has undergone lumbar puncture procedure. The appropriate position for the client for at least 12 hours post procedure is option A, B, C, or D. Yes, the correct option is option number D, that is supine position. Now moving to the next question, question number 27. Device shown in the image is A, jaundice meter, B, vein locator, C, temperature probe, D, infrared thermometer. Yes, the correct option is that is vein locator, option B. Question number 28. The nurse is assessing deep tendon reflexes of a patient. Refer to the image and identify which tendon reflex is examined by the nurse. A, bicep reflex, B, tricep reflex, या C, patellar, या D, Achilles reflex. Yes, the correct answer is that is option A, biceps reflex. Now moving to the next question, question number 29. Identify the significance of the instrument shown in the image. A, to dilate the neck made into the airway. It allows the easy insertion of tracheostomy tube. या option B, to hold the cervical lip. C, used as a hemostat to clamp blood vessels. या option D, to hold back the abdominal wall during the abdominal procedure. Yes, the correct option is that is option A. To dilate the neck mate into the airway, it allows the easy insertion of tracheostomy tube. Now moving to the next question. Deformity marked in the image is termed as A. Swan neck deformity, option B. Bowtonia deformity, option C. Heberden nodes, या D. Ulnar deviation. Yes, the correct answer is option A. Swan neck deformity. Now moving to the next question, question number 31. Anomaly shown in the image is referred as A. Cleft palate, B. Deviated nasal septum, C. Deviated nasal bone, या D. Anisocoria. Yes, the correct option is that is B. Deviated nasal septum.